Midland Met is one of the largest new hospitals to open in England in the last 10 years. It's been a major investment for this local community, which is one of the most deprived communities and local populations in the country, so the investment was so needed.
And it feels like no hospital I've ever stepped foot into. It feels open, light, warming.
It's amazing. It's such a change to what we were working in before. Just 110 days ago, we were working just a mile and a half down the road where the wards there were designed by Florence Nightingale. We've moved from a hospital that was 135 years old into this fabulous modern healthcare facility.
The new spaces, the green spaces here in this building are fantastic. The whole hospital has been designed with wellbeing in mind, and the fabulous 6 internal green spaces really do add to that calming, restorative environment that we know benefits patients and our staff so much. The maternity services here are amazing, and our staff work really hard to ensure that every woman and family get a personalised, safe, high quality birthing experience. And the new facilities here at Midland Met really support them to do that. The environment now really matches that ambition. It's really supporting the staff to be able to deliver that high quality care in an environment that anybody would want to give birth in.
The shift of hospital-based care into the community has actually avoided the need for us to use 78 acute beds, and our length of stay has started to reduce. So again, this real shift of care into the community is ensuring we care for patients at the right place at the right time with the right specialists, leaving this building, which is designed to look after our very sickest patients.
Surprisingly, despite how long this build has been going on for, people were relatively low in their awareness and knowledge of the opening itself and the services that would be eventually moving into the building. So we had a real challenge in ensuring that people knew when the opening was happening, where they would need to go for their emergency care on that day. We were really focused on the safety and the smooth transition of those services, making sure our staff were engaged, they knew where they were going, they felt a sense of pride and ownership in the building. Ready and ahead of opening was really important to us. As a mum myself, I know how daunting it can be to take any child to an A&E department, and that's why we've created a warm, friendly, welcoming environment with a dedicated entrance and facility for our children who may be unwell. The Learning Campus is the first university campus here in Sandwell, and it really is a game changer for healthcare education. It will provide higher, further and apprenticeship level training opportunities for new workforce, but it will also provide a facility for our existing workforce to further their training and development.
Midland Met is so much more than a hospital. It's a catalyst for regeneration. We work in partnership with West Midlands Combined Authority, Sandwell and Birmingham councils, and have committed to a regeneration zone and to really bring the benefits of this building to place and the local population.
Starting to see how the space is inviting new behaviours and supporting people to come and visit their loved ones, for those people to use the space to get back some of that independence and to rehabilitate themselves as they're walking around the environment.